Mr. Speaker, it has always been the practice with health regions, including when members opposite were the government. It's always been the case that health regions are going to back up their requests for funding with the case. They will make the case for specific requests of the government. That is exactly what's happening here. The government's responded to a need here in terms of the urgent requirement for $10 million of additional funds, and also some mid and long-term measures, Mr. Speaker. We're going to continue to do that analysis and continue to provide the health care that Saskatchewan people deserve. I wonder if members can, the Leader of the Opposition might want to share with this Assembly what kind of business case went into closing 52 hospitals, Mr. Speaker. What kind of business case did the NDP do when they shut down the Plains Hospital, which today causes trouble in ERs in this city? I'll tell you what the business case was under the NDP. They said closing the Plains Hospital would save $10 million on the budget. Mr. Speaker, we've saved twice that, leaning out blood inventory management. This government will continue to put a priority on healthcare capital, on ensuring that we're doing healthcare capital maintenance in this province, unlike what members opposite did in those long, long, dark years of NDP government, Mr. Speaker. Speaker, we're talking about dollars over and above the allocated budget. We're talking about funding beyond what was budgeted for any of these institutions by the regions. So we know there are a number of needs in a number of the regions, in a number of the care facilities. They're going to make their case to the regions, and in this case to the government, for additional funds, Mr. Speaker. And when they do, when they make that case, and by the way, this is exactly the same process that members opposite used for any additional funds over and above what they would have budgeted, the same thing, notwithstanding the Leader of the Opposition's shock about it all. It's precisely what they did. Mr. Speaker, here's some more facts that he should be more surprised about. In our first 6 years of government, the Saskatchewan Party government invested $1 billion in healthcare capital. We're opening long-term care facilities. They closed long-term care beds. We're opening hospitals in communities across this province, Mr. Speaker. They only announced the hospitals. We had to actually fund them and do the opening. $1 billion in our first 6 years versus $300 million in their last 6 years. Mr. Speaker, there's more work to do, but I think the people of the province understand which side is ready for growth and ready is for what's needed in the healthcare system, Mr. Speaker.